and proceed to session 1. So for this session, we have two speakers who will discuss about government and CSC initiatives. So allow me now to introduce to you our first speaker. Our speaker is currently the Director of Capacity Building and Training Service of the Office of Civil Defense. She spearheads the development of standards on disaster risk reduction and management training courses and institutionalization of the National Disaster Risk Reduction and Management Institute, or the NDRRMTI. She leads in the conduct of several DRRM training-related researches, such as Incident Command System and Community-Based Disaster Risk Reduction and Management. She also heads the establishment of DRRM Training Information Data System and DRRM Knowledge website. Likewise, she pioneers the advocacy initiatives on earthquake preparedness. Being a DRRM worker, she believes that little or no response is needed if we are better prepared. So ladies and gentlemen, let's all welcome Director Susana G. Juangco.
Good morning, everyone. Can I have the slide, please? Can I have for the slide? Thank you very much. So we'll be having the what are the initiatives that was done by the Office of Civil Defense, and pakita ko rin po what are the other initiatives being done by other government agencies. So the outline of the presentation will be, I'll be sharing with you the Public Service Continuity Plan, and then initiating continuity of service and the summary. So for the next, please. So what we'll be discussing now will be the public service continuity. Next, please. So what is public service continuity? Next. So basically, pakiclick po ulit. When we talk about public service continuity, we're talking about the capability of public sector or the organization to continue the delivery of services at acceptable predefined levels following disruptive incidents. So ito po yung kahit sinong organization, specifically on the public sector or national government agency, it's national or local government, we need to continue our services kung halimbawa magkakaroon po ng isang disruptive incident. Dito katulad ng isang hazard, katulad ng isang bagyo. Next slide, please. So, saan ba natin titingnan yung public service continuity when we're talking about disaster risk reduction and management? Meron pong 4 na pillars ang disaster risk reduction and management. There's prevention and mitigation, preparedness, response, rehabilitation, recovery. Yung event po na nandito, kung halimbawa po na magkaroon ng isang bagyo o isang disaster o kung anumang hazard na nandyan, dito po natin ipapasok ang public service continuity. So, kung nagkaroon ng bagyo at magkakaroon ng interruption in the service of the government agencies, then we shall be implementing public service continuity. Next, please. Paki-click po ulit. Now, sige pa po. So, in the entire thematic area or thematic pillar of DRRN, what we'll be implementing is can either be the national, the regional, or the local disaster reduction management plan. But entirety, in all of this, meron po tayong take-to-isang plan for every thematic pillar. Next, please. Next, paki-click lang po. Sige pa po. Okay. Now, with this one, what we're looking into is sa bawat plano po na nandito, prevention, mitigation, preparedness, response plan, and rehabilitation recovery plan, dito po natin ipapasok bago natin ma-apply yung ating response plan. We need first to apply or to implement our public service continuity plan. So, bago tayo makaresponde sa event nito, then we need to implement or to start doing our public service continuity plan. Next, please. So ano po ba yung difference? Pakiclick na lang po lahat sunod-sunod para po ano tayo. So what is, hanggang dyan lang po. What then is the difference between public service continuity plan and contingency plan? Now, when we talk about contingency plan, we're talking about pagdating po sa hazard, it's hazard specific. So there should only be one hazard in every contingency plan. So kung gagawa tayo ng contingency plan, kung ito ay for earthquake, it will just be for earthquake. If it is for typhoon, it will just be for typhoon. However, when we talk about public service continuity plan, we're talking about all hazards. We're talking about all risks na meron related to the hazard. So wala po tayong tinitingnan na specific hazard para dito. Kasi po, when we talk about public service continuity plan, ang tinitingnan po natin dito is the critical functions that will be affected in our organization. While doon po sa contingency plan, ang tinitingnan po natin dito, what will be the critical impact of the hazard based on a worst case scenario. So if it will be earthquake, for example, kung ito ay the possible movement of the West Valley Fault or yung big one sa bawat locality natin, then we're talking about what will be the worst case scenario related to that hazard. At doon po tayo gagawa ng action. Now, when we talk about contingency plan, we're talking about internal and external response, which means what will be your internal response within your organization, and what will be your external response para po doon sa mga tao na magiging affected. When we talk about public service continuity plan, we're talking about immediate internal recovery. Kung paano po naapektuhan yung ating organization, how are you going to recover first internally? Kasi you cannot do response, you cannot continue the service unless meron tayong internal recovery. Now, paano nag-link itong dalawa, the PSCP and the CP? Both of them are activated during response phase. Both of them, ginagawa po natin the internal recovery and the internal external response through our internal and external processes. So, doon po natin nakikita what is the difference rather, or how the public service continuity plan and the contingency plan are interrelated with each other. Next slide. Next slide po. So, ano po ba yung PSCP? Pakiclick na lang po ulit. So, PSCP, ito po yung dokumento ngayon. This is the entire plan or the document that contains all the strategies and the mechanism na gagawin po ng government agencies in order for that agency to ensure the continuous delivery of the services to the public amidst any disruption. So, ito na yung gagawin mong plano, gagawin mong strategies, gagawin mong i-establish mo na mechanism, gagawin mo na activities para sa gayon, hindi ka magkaroon o magkaroon ka man ng discontinuance ng iyong serbisyo sa ating publiko, matutuloy mo in a very short time, meron kang return time objective na kung saan dito kailangan diretso na ako sa ating service na pagbibigay ulit sa publiko. So that is public service continuity plan. Next slide. Meron po tayong 6 R's or requirements when you talk about public service continuity plan. So one is risk assessment. If you're going to do the plan, you first have to do your risk assessment. Risk assessment taking into consideration your organization, taking into consideration your environment, vis-a-vis all the hazards that may affect your organization. And then the ranking. Ranking is talking about the mission essential function. So ito po yung mandato ng inyong organisasyon. Ito yung tinitingnan natin among the mandates of our organization, alin ba dito yung unang-una kong dapat ibalik so that I may be able to continue the service. Alin ba dito yung pinaka-essential na siyang pag ito ang una kong ginawa, makakabalik ako sa servisyo. Wherein, yung recovery time objective, ito yung timeline. Kailan ko dapat ibalik o kailan ako dapat makarecover kaagad according to the mission essential functions that I have identified. Your right continuity strategies focuses on the strategies, on the mechanism, on what you should be doing, not only for response pagdating sa in implementing the public service continuity plan, but also pagdating doon sa paano mo i-improve ang iyong organization, ang iyong agency in order for you to continue to have a continuum of your services. And of course, resources, ito yung kailangan natin. Both manpower, lahat po ito, equipment, everything. Kailangan natin because you cannot implement a public service continuity plan unless you have all the resources. And readiness is talking about testing. When you have already developed your public service continuity plan, you should be able to test the plan so that malalaman po natin if the plan is readily applicable. Next, please. Next slide, please. So, ano po ba yung reasons for continuity planning ng ating serbisyo publiko? One is we should be able to ensure the continued delivery of vital services to the public. Ito yung gusto natin. Kailangan, sabi nga po natin, public service should always be in a continuum. Next is to reduce or mitigate disruptions to operations. And last is to ensure succession if agency leadership is disrupted. So kung halimbawa, yung pinakamataas natin leader sa ating organization, halimbawa hindi siya available, then sino ba yung dapat na susunod? Hindi po pwede po when we talk about public service continuity plan or continuity planning na, hindi po ito, we cannot decide on this because the decision maker is not here, is not around. It should not be that way. So there should be succession of leadership na nandoon siya at nakalagay po yon sa ating continuity plan. Next, please. So when we talk about public service continuity plan development of this, these are the parts. There are 15 parts of the public service continuity plan. Hindi ko po ito isa-isahin. Next slide, please. Because meron po tayong public service continuity planning guidebook. See, the Office of Civil Defense is doing the training about public service continuity plan. And also, meron po tayong step-by-step guide on how are you going to develop the public service continuity plan. Para po itong cookbook. So, it is reader-friendly, user-friendly, para sa gayon, makikita natin. Habang ginagawa natin yung 15 steps kanina, ito po yung guide natin, paano natin bubuuin ang bawat steps na nandoon. Next slide. Now, bakit ba kailangan ng public service continuity plan na to? Bakit kailangan tayong gumawa sa ating whether it be national government agency or local government agency? There's an issuance from Malacanang for all of us to develop our service continuity plan. However, ito po ay because of nakafocus lang siya ng sa earthquake. And another one, pakiclick po. Nag-issue din po ang National Disaster Risk Reduction Management Council wherein ibinigay natin kung ano yung template. Ito po yung kaninang 15. Kanina nag-issue tayo, this will be the template that should be used by the national government agencies and the local government agencies in developing their public service continuity plan. Next po, pakiclick ulit. And then, ginawa po tayo after the issuance, we did the training, and then ngayon po nag-issue tayo ng update on the public service continuity plan. If you can still remember, sabi ko dun sa una, the issuance from the Office of the President is focused on ginawa po yun kasi because of the possible, yung big one sa atin. However, because of the present situation that we are now having at the occurrence of pandemic, kailangan po, sabi natin, di ba, all hazards. So dapat ngayon talaga pumasok na rin even our health hazards doon po sa ating public service continuity plan. That's why we issued a memorandum updating the public service continuity plan and the contingency plan. Next, please. Now, also, we need the PSCP because of the sub-task group on governance. Next, pakiclick po ulit. Meron po tayong tinatawag doon na the main focus area, ensuring continuity and efficiency in the delivery of public service. This we wanted because of what had happened now, dito sa pandemic na po natin na ito, marami sa atin nung nagsimula na nagkaroon tayo ng kahirapan. Paano ba tayo babalik ng ating public service o ating service sa mga publiko, sa ating mamamayan. Kaya po dito, that we are now on the recovery phase, para po dito, we wanted to continue yung ating service to the public. That's why meron po tayo ditong main focus area. That's why lahat po ng national government agencies and local government units should have a public service continuity plan. So ito po yung basis natin for this. Next, please. Next slide. Now, ano po yung ginawa natin these are already the people and the agencies are already trained when we're talking about public service continuity plan. So ang Office of Civil Defense po has conducted a training, orientation, workshop para po sa gayon maging alam ng mga tao ng taong na nasa gobyerno ang paggawa ng public service continuity plan. And on the table below are the government agencies who have already submitted their public service continuity plan to the Office of Civil Defense. Next slide. Now, punta po tayo dito sa susunod. It's initiating continuity of service. Next slide. Now, the National Disaster Risk Reduction Management Council po is the highest organized body for DRM in the Philippines. Kami po yung siyang namamahala pagka po tayo ay not only during disaster, but sabi nga natin kanina, dun sa four thematic area of disaster risk reduction and management. So from prevention, mitigation, down to rehabilitation, recovery, it is the National Disaster Risk Reduction Management Council. Ito po yung lahat po ng member nito. We have 44 members that kasama po doon, the different national government agencies and the different stakeholders. Sila po, ito po yung namamahala pagdating po sa disaster risk reduction and management. Next slide. Now with NDRMC, ang Office of Civil Defense po serves as the executive arm and the secretariat of the council. So ito po ngayon ang siyang nag-orchestrate or nagko-coordinate sa lahat po ng member ng council para nang sa gayon, ito po ang siyang titingin para nang sa gayon, lahat ng 44 members of the council are doing orchestrated or doing one coordinated prevention, mitigation, preparedness, response, and recovery when we talk about PRRM. Next slide. Dito rin po sa Office of Civil Defense, nandito po ang 24/7 Operations Center natin. So ito po yung facility or ito yung ating Operations Center na kung saan ito po yung nagmo-monitor at nagko-coordinate during emergencies and disasters. So yung mga nadidinig po ninyo ng mga text messages na tatanggap ninyo, yung mga nakikita po ninyo, napapanood ninyo sa TV and the news and all the response operation, dito po siya kino-coordinate. Ito sa ating 24/7 Operations Center na nandito po sa katabi po ng Office of Civil Defense. Now, paano po kung itong NDRMC, the Office of Civil Defense, with the 24/7 Operations Center, next slide, bigla pong ma-discontinue dahil nagkaroon po tayo ng emergency or disaster. Just imagine, paano natin i-orchestrate ngayon ang ating disaster risk reduction and management. Now, ano po ang ginawa ng Office of Civil Defense, especially po na nagkaroon po tayo ng pandemic na ito brought about by COVID-19. Next slide. Ang una po natin ginawa, we followed what the Civil Service Commission has issued, the memorandum circular, focusing on the alternative work arrangement and support mechanism para po nang sabihin, diretsyon may papasok sa ating pong Office of Civil Defense at tatao dun sa ating 24/7. Next slide. What we did is we issued memorandum with regards to the work from home guidance during NECQ in the National Capital Region. Ito po yung dito po sa ating po. Dito po kasi po ang Office of Civil Defense ay nandito po sa National Capital Region. However, meron din po tayong initial na memorandum para po naman dandun din po sa iba't ibang regional offices po ng Office of Civil Defense. So meron pong work from home guidance para po dito nandito sa Central Office at samantalang yung pong nasa regional office, meron din po doon tinatawag tayong work from home arrangement. However, meron pong pumapasok po dito yung skeletal force na nandito po sa ating pong bawat opisina at the central office and at the regional offices. Para po mayroong tatao dun sa ating 24/7 at meron pong magmamando dun po sa ating response operation. Next slide. Meron po ang Office of Civil Defense had already developed our public service continuity plan. Ang hirap naman po na kami nagtuturo how to develop the PSCP tapos wala kami. So it's already an approved public service continuity plan na kung saan ito po yung sinunod namin, ito po yung ginawa namin in order for us to continue our service to the public. So ito po ay approved na ng ating pong mga heads of offices. Next slide. Ito po yung paano kami bumalik o ano yung mga ginawa namin ng mga paraan po dito sa Office of Civil Defense. Dito po sa amin sa opisina, meron po kaming isolation room for personnel with COVID-19 related symptoms during daily symptoms assessment. Paano po ito? Meron po dito sa amin kinukuha yung thermal scanner, tinitingnan po may health declaration. Kung may lalabas po doon na mayroon kang symptoms ng COVID related to COVID-19, then ipapasok ka po dito sa isolation room. So we have a built-in isolation room here na kung saan dito ka at meron po kaming tinatawag na medical clinic kung saan titingin po dito. Bawat building po sa aming opisina as a food disinfection para po nung sa gayon magkaroon ng walang papasok dun sa loob ng opisina na pwedeng magkaroon may virus na related to or itong SARS-CoV-2 virus na ito. Next please. Kung halimbawa po na ang aming personnel ay nagkaroon ng exposure to any COVID positive patient, meron pong binibigay na quarantine kit doon sa work from home personnel at doon po sa nandoon sa naka-quarantine. So ito po ang laman ng aming ating tinatawag na quarantine kit. Ito po ay dinapadala doon na deliver diretso po doon sa kanila, kanya-kanya mga bahay. Next please. The PPE is also being provided to each employee of the Office of Civil Defense. Next please. Also, we make it sure na yung aming work environment ay siya po ay COVID-sensitive area. So nagkaroon po ng installation of social physical barrier para yung sa gayon, bawat empleyado po ay hindi magkakaroon magkaroon ng lesser chance when it comes to exposure. So bawat lamesa po o bawat empleyado, may separate po siya na acrylic para po yung sa gayon. Hindi man sila, magkakatabi man sila, meron pa rin tayong matatawag na barrier for physical distancing. Next please. We also do the regular disinfection of the work area. Hindi ko lang po mapakita sa inyo yung picture kasi hindi kami pwedeng pumasok pag nagkakaroon ng disinfection. But the disinfection is being done regularly at the Office of Civil Defense, especially kung meron itong makita na meron ma-identify na positive COVID patient. Next please. Ito po yung sinabi ko kanina, the regular health monitoring of employees with a Viber group wherein yung pong bawat empleyado, whether ikaw ay work from home or na din ka sa opisina, ilalagay mo doon ang iyong health status. Ilalagay mo doon ang iyong temperature, ilalagay mo doon kung ikaw ay nagkaroon ng exposure to any unknown COVID positive patients or positive cases. Ilalagay mo kung meron kang signs and symptoms related to COVID-19. So, i-declare po yun sa Viber group ng bawat division, bawat service na meron po kami. And of course, yung thermal scanner, and then meron po kaming health declaration form na kung saan sinifill upan ng bawat empleyado po pumapasok. Next please. Now, one of the function of the Office of Civil Defense is to capacitate the disaster risk reduction management officers dito po sa buong Pilipinas. Now, before we're doing the traditional form of training, it's the face-to-face training. But now, hindi na po natin pwedeng gawin yon because we need to follow the minimum health standards. So what we did is we created or we redesigned yung our training courses natin. What we did to do the blended learning. Ano po yung blended learning? One, meron kaming online courses, the digital course para po dito sa ating training on BRRM. Next, meron po tayong face-to-face na kung saan ito po yung hindi natin magagawa na like for example, hindi pwede siya na gawing online lahat. So pwede pa rin po mag face-to-face but to a limited number of people para dito. And dahil blended siya, we're also doing the modular. Meron din po kami magiging modular training para na sa yun. Ito yung para doon sa hindi maaabot ng ating mga internet connection. So when we talk about blended learning, we're talking about online, yung limited face-to-face, and the modular training that we will be offering. Nagkagawa na po kami ng interim guidelines when it comes to how the disaster risk reduction management training courses will be offered not only at the central office but also at the regional offices, and this can also be implemented at the local government units by our local disaster risk reduction management officer. Next slide. Now, ito po yung sinasabi natin na iba't ibang online courses or webinar na na-conduct na po ng ating pong Office of Civil Defense because we wanted to continue building the capacity of our of our disaster risk reduction managers pagdating po sa DRRM. So ito po yung huli namin ginawa, it's the earthquake preparedness webinar wherein we had several, more than 1,000 na nag-attend po ng training na to, both in Zoom and our Facebook Live and sa ating pong YouTube channel. Next, please. We also conduct kasi po, sabi natin kanina, diba, we have 44 members of the council. In each of the thematic area are several, meron po tayong mga vice chairs. Now, how do we still do ito pong ating mga consultation and consultative meetings with all of these people? So we do the Zoom meeting, we do the webinar, the digital meeting. So ito po lahat tayo ngayon on the digital world. So we are able to still communicate, take consultation, and do our workshops and our meetings, the full council meetings through our digital platform. And also, yung pong ating meeting with our ASEAN partners, because the Philippines po is a member of the ASEAN pagdating po sa DRRM. We also do that through our digital world. Next, please. Next slide. And lahat din po ng ating mga susunod ng ating mga ginagawa po natin mas malakas yung pong ating online. So mamaya po, today is September 10. Ngayon po ang third quarter nationwide simultaneous earthquake drill. And yes po, even the earthquake drill will be done online. So ito po ay magkakaroon po tayong ceremonial pressing of the button mamayang 2:00 na kung saan ito po ay gagawin online, and this will be participated by the different people, hindi lamang po dito sa National Capital Region, but for the entire Philippines. So we'll be having the different secretaries, the vice chairs, ng lahat po ng ating 4 thematic pillar. So para po ng sa gayon, sila po ang nandito para sa ceremonial pressing of the button. And of course, the chair of the Disaster Reduction Management Council, we have our Secretary Susana. Sila po yung mapupunta po para mamaya sa 2:00. What we also did, the online press B. So we wanted to do ito pong ating pong tinatawag na the continue connecting with the people in order for them to learn about DRRM even online. So mamaya po, iniingahan ko po kayo para sa third quarter and set to do the duck cover and hold that will be done online para po sa gayon patuloy pa rin nating mabuo ang ating mga skills pagdating sa disaster reduction management, especially when we're talking about earthquakes. Next, please. Now, pagdating po doon, ito po yung mga ibang sinasabi po natin na ibang government agencies. One is, ito po yung DepEd. Nagkaroon po ng cancellation ng kanila po mga after-school activities. So what Department of Education did is to do the migration to online learning. So, ibig sabihin po nito, hindi lamang ang OCD ang siyang gumagawa nito, but even the other national government agencies have their tinatawag po natin na innovations or how they're going to go back sa kanila pong continuous of their service in order for them to fully fulfill their mandate. So ito po yung Department of Education. Next, please. Next slide. Ito pong nakikita natin is nakuha namin from the Quezon City General Hospital in order for them to continue yung kanilang pagbibigay ng medical management para po sa ating mga PUIs. Nagawa po sila ng makeshift health facility outside din sa Quezon City General Hospital para na sabihin dire-diretso yung kanilang management for our COVID positive patients. Next, please. This is also in the government hospital in Cebu, wherein nagawa din sila ng field hospital. Ito naman po ay para sa earthquake victims. Nagkaroon po ng malakas ng paglindol sa Cebu. So yung pong ospital ay hindi po na-declare po na hindi po pwede muna na mag-admit ng pasyente at sila po ay nagkaroon ng surge, ng overwhelming surge capacity dahil po din sa mga maraming biktima ng lindol. So what they did is to make a field hospital outside of their facility or of their building. Next, please. Ito yung sinasabi natin kanina pagdating doon sa 6 R's when we talk about public service continuity plan. Kung minsan kailangan natin sa resources is yung ating getting the buy-in of our stakeholders. So ito po yung COVID-19 treatment centers na wala pa siyang power kasi kailangan natin ituloy yung pong ating serbisyo para dito matuloy, para magkaroon dito sa treatment center. So ito yung partnership with Meralco para na sa gayon malagay yung power supply din sa ating treatment center. So this is still part of public service continuity plan, talking about the strategies that we should be doing and the partnership that we should be doing in order to implement yung ating PSCP and continue our service to the public. Next, please. Next slide. So basically, that's how the Office of Civil Defense have done how we initiated the continuity of service and all the other national government agencies and even the local government agencies. So as a summary, next slide. This mechanism of a government agency to ensure continuous delivery of services to the public amid any disruption should be institutionalized. So kailangan po natin yung public service continuity plan. We cannot institutionalize the continuous delivery of service not unless we have a plan, not unless we have identified the strategies that we wanted to do, not unless we're able to identify first, rather, the risk na meron ng ating organization vis-a-vis the different hazards na meron tayo, and then identifying the minimum, the essential function, identifying the strategies, identifying the resources that are needed, and testing ano man po kung ito bang ating ginawa na plano ay applicable. So this should be institutionalized in all the national government and the local government units in the entire country. Now, next po is all government agencies should have an approved and ready, when we say ready, it is tested, public service continuity plan. Hindi po pag na-develop na natin siya, develop na siya, yun na yun. No, it's not. It should be approved kasi po kailangan natin ng budget para dito. So kung halimbawa makita natin sa inyong risk assessment, you cannot continue kung halimbawa magkaroon ng lindol because ang inyong building ay hindi pala siya pumasa sa building standard, then kailangan po niyo ng budget para na sa gayon magkaroon pa ng retrofitting ng iyong building. So ito yung sinasabi natin na kailangan may approval because pag in-approve po ng ating heads of offices to, ibig sabihin, kasama po dito yung budget na identify ninyo para dito. And tested, kailangan po siya na test natin, meaning to say, we have done either a tabletop exercise or a functional exercise, any simulation exercise for that matter, in order for us to know whether our public service continuity plan is applicable. And the last but not the least, there is no timeout in public service. Next slide. So, yun lang po ang ating pong masasabi. So, you can always contact us para po dito sa anuman. Dito po sa aming sa capacity building and training service. Ito po yung aming office civil defense and follow us in our social media accounts. Next slide po. So, again, last slide na po. Maraming salamat po again, Director Susana Juangco. Thank you very much. Magandang umaga po sa inyo lahat.
Once again, thank you so much, Director Juangco, for sharing with us OCD's initiatives in dealing with this COVID pandemic, and also for informing us about the public service continuity plan. I am sure our participants have learned from your sharing. Thank you again, ma'am.